Hello, as an advocate for cleaner environmental standards for the City of Los Angeles, I'm pleased to inform you that the Environmental Affairs Department, the Bureau of Sanitation, and the California Dental Association are engaged in a proactive campaign to reduce the environmental risk posed by mercury and mercury-based compounds used by the dental profession. This training video demonstrates the simple and effective best management practices that are being taken to eliminate the discharge of these compounds to the environment. We are confident that when applied, these practices will prove valuable to the dental profession, their patients, the community at large, and the environment. Thank you for your attention.
California was once a major producer of elemental mercury. Extracted from the sulfide mineral cinnabar, its luster is similar to polished silver. Medical use dates back more than 2,000 years as an antiseptic, diuretic, and skin ointment. Its use in dentistry dates back over 150 years, when amalgam fillings were prepared by mixing liquid mercury with silver powder by hand. When mercury is mixed with other metals, such as silver, copper, tin, and zinc, it forms a durable alloy. Amalgam fillings typically contain less than a gram of mercury. While the individual amount is small, improper management of the removed and excess amalgam can impact the environment.
A dental office generates 115 grams of mercury per year. This is roughly 1/4 of a pound. Now multiply that number by 2,000, which is the number of dentists in the city of Los Angeles. Over 500 pounds of mercury is generated, and if not properly managed, can be discharged to the city sewer system. The treatment plant limitations for mercury are eventually going to tighten, and mercury waste generated at a dental offices, therefore, is no longer considered trivial. The concern about mercury entering the treatment plant is that mercury passes through and goes directly into the ocean, where it becomes bioavailable and toxic to aquatic organisms, fish, wildlife, and eventually humans.
Dental amalgam waste should not be placed in the trash or in a medical waste red bag. It should not be sent to a solid waste landfill. If flushed to sewer, the amalgam waste can pass through the sewage treatment plant and be discharged to the ocean. There, the inorganic mercury may change form, bioaccumulate in plants and fish, and impact the food chain. Back at the treatment plant, the amalgam waste can also settle out with the biosolids. This may prohibit the beneficial use of the biosolids as fertilizer.
For several years, CDA worked with San Francisco area agencies on this issue. Currently, we've been working with the City of Los Angeles to gather research and information so that we can disseminate to the public and to our members. Our goal is to be able to provide accurate information so that our dentists can use best management practice for this waste in their offices so that we can ensure that our patients are healthy and that the environment is safe.
By adopting best management practices, or BMPs, in your daily routine, both workplace safety and environmental protection can be achieved. Workplace safety, as related to amalgam preparation, requires an easy-to-clean work environment, use of self-contained equipment, and ready access to spill kits. An easy-to-clean and impervious work surface is an important safeguard against mercury exposure. Spilled mercury can hide in cracks and crevices and present an ongoing hazard. In offices where bulk mercury was once handled, it may still be present in old carpeting or beneath baseboards. Test kits should be used to check surfaces if mercury contamination is suspected. Enclosed amalgamators should be used to minimize the area of release in the event of a spill. Always be sure to cover or close the amalgamator before turning it on. Keep the cover closed until the unit is turned off and the capsule comes to a complete stop. In the event of a release, mercury spill kits should be readily available. Take the time to read the instructions and know how to use the kit before a spill occurs. Know what to do with the resulting waste. Do not wait for an emergency to learn what to do. And never use a commercial vacuum cleaner or chairside vacuum system to clean up a mercury spill. To do so can increase your risk of exposure. The protection of the environment via pollution prevention follows a well-defined hierarchy of source reduction, followed by recycling and reuse, followed by treatment and disposal, the least preferable option. BMPs related to source reduction seek to avoid or reduce the use of hazardous compounds, either by substituting a different product or by improving the efficiency of use. When usage is reduced or eliminated, so too is the amount of waste that is subsequently generated. Today, various restorative materials are available for use. Proper material selection must take into account such factors as cost, durability, and cosmetic appearance. To help make better informed decisions, California dentists will provide their patients with a dental materials fact sheet prepared by the State Dental Board. For restorations involving amalgam, the use of pre-dosed and pre-capsulated amalgam can help achieve better product quality, reduce the potential for spills, and minimize excess waste. The old practice of mixing metal powders with bulk mercury should be discouraged. In 1994, the ADA issued the following policy statement, recommending that dentists eliminate the use of bulk dental amalgam mercury and bulk amalgam alloy, and that they use only pre-capsulated alloy in their practices. Amalgam capsules can be purchased in units of 1, 2, or 3 spills, a term given to a fixed amount of mercury. Capsule size should be matched to the restoration so as to avoid the mixing of excess amalgam. All excess must be properly collected and managed for off-site recycling or be disposed of as hazardous waste. Most amalgam waste, regardless of source, can be recycled for its mercury and silver content. Empty capsules, even those that appear to be clean, can retain small amounts of mercury. Such capsules may fail testing and be classified as hazardous waste. Since one cannot visually determine which empty capsules will fail testing, all should be recycled for their mercury content or be disposed of as hazardous waste. The same applies to broken or unusable capsules. The function of the chairside trap is to prevent solids from entering the vacuum system. A maintained trap retains about 60% of the amalgam waste that enters the evacuator line. The chairside trap should be routinely disinfected at night and replaced as needed in the morning. For a typical operatory, disposable traps should be changed weekly, or more frequently if loss of suction is noted. Disinfected traps that contain amalgam should be stored in a suitable container for shipment to a recycler or pickup by a hazardous waste hauler. Amalgam-containing traps should not be placed in the trash, in medical waste red bags, or be cleaned in the sink. Disinfected traps from an operatory dedicated to non-amalgam procedures may be disposed of as trash. A non-oxidizing line cleaner should be used to disinfect the trap. Oxidizing cleaners, such as bleach, have been found to leach mercury and other metals from the amalgam. Also, check the material safety data sheet to ensure that the line cleaner does not contain toxic metals such as chromium. The presence of toxic metals may render the spent cleaner hazardous and prohibit discharge to sewer. An operatory chair equipped with cuspidor should not be used for amalgam procedures. Most cuspidors discharge directly to drain, and it is difficult to prevent the release of amalgam to sewer. Fortunately, the use of cuspidors is no longer common, and their disuse is encouraged. The purpose of the sink or plaster trap is to prevent the discharge of solids to sewer. Waste amalgam should never be flushed down the drain. It will collect in the trap and contaminate the non-hazardous solids. This mixed waste cannot be recycled, and proper disposal is expensive. To avoid this problem, inspection and manual removal of amalgam from the dirty tool should be conducted prior to rinsing. Removed amalgam should then be properly stored for recycling. Suction at the operatory chair is created by a vacuum pump system, often located in a remote utility room. Some pumps have a filter that can recover about 50% of the amalgam that passes through the chairside trap. Periodic filter replacement is essential for maintaining performance. The dirty filter should be placed in a sealed container and sent off for recycling or disposal as hazardous waste. New separator units are available for recovering most of the dental amalgam that enters the vacuum pump system. Some separators even employ special resins to remove soluble mercury.
With CDA working with city and state agencies and working with the American Dental Association, we can provide the necessary information so that our dentist members can evaluate products. In just a few months, we believe, the American Dental Association will have a paper which will be doing a pretty good evaluation on dental separators. That information will help our members make the right choices if they choose to add a separator to their best management practice.
Before purchasing and installing a separator system, check with your local agency as to current permitting requirements. The recycling container should be labeled with the name, address, and phone number of the office, along with the date first placed in service. You must also keep a log of your amalgam waste generation and disposal. Some recyclers will provide you a certificate of recycling to acknowledge receipt of your waste. Such records and certificates will help you verify compliance. Many recyclers will accept scrap amalgam along with empty capsules, disposable side chair traps, vacuum filters, and extracted teeth with amalgam fillings. Check with your recycler regarding their specific requirements for handling, shipment, and disinfection. Amalgam that has been in contact with bodily fluids may need to be identified as contact amalgam. If requested to disinfect with bleach, keep in mind that you cannot discharge this liquid to drain. The use of non-oxidizing disinfectant does not present this constraint. A listing of amalgam waste recyclers, along with additional information regarding all of the BMPs presented in this video, is available from the City of Los Angeles Industrial Waste Management Division. This colorful guide also discusses environmentally responsible dentistry with reference to wastes generated from X-ray processing and the use of disinfectants. A copy may be obtained by contacting the IWMD. It is free for the asking.